Discectomy is a surgical procedure that attempts to relieve pressure on spinal nerves and the cauda equina. It's most commonly performed to relieve the pain caused by a ruptured or herniated disc pressing on nerve roots. There are 24 vertebrae in the spine. These vertebrae are connected by several joints. The main joint is a flexible cushion between two vertebrae called an intervertebral disc. The intervertebral disc is comprised of a soft gelatinous center surrounded by a tough outer wall. When the gelatinous core pushes out through a tear in the fibrous wall, the disc herniates, adding pressure to the surrounding spinal nerves, which causes pain. When undergoing a discectomy procedure, you will be positioned on your stomach on the surgical table, surrounded by the appropriate surgical draping. An X-ray of your spine will be taken to show the appropriate disc space. Your surgeon will make a small incision along your middle back. A retractor may be used to provide your surgeon direct access to the affected area. Next, your surgeon will remove the protruding or herniated portions of the disc. The healthy portion of the disc is left intact. Pressure on the nerve root is relieved and pain is alleviated.
Although the incidence of risks and complications of surgery are rare, you should be aware of them. Damage to a nerve root. This occurs in less than 1 out of 100 cases. Damage to the cauda equina and paralysis, which means the loss of use of the legs, loss of sensation, and loss of control over bladder and bowel. Infection. Superficial wound infections may occur in up to 4 cases out of 100. Deep wound infections may occur in fewer than 1 out of 100. Recurrent leg pain as a result of scarring or recurrent disc prolapse. Rarely, the surgery may make your symptoms worse than before. Tearing of the outer lining or covering which surrounds the nerve roots, which is called dura. This is reported in fewer than 5 out of 100. Blood clots, thrombosis in the deep veins of lungs or legs. Bleeding. Problems with positioning during the operation, which might include pressure problems, skin and nerve injuries, and eye complications, including very rarely blindness. A stroke, a heart attack, or other medical or anesthetic problems. Extremely rarely death as a result of damage to major blood vessels or vital organs around the spine, which is reported as happening in 1 out of 10,000 cases. Thank you.